Hi, it's Dr. Fan here, and I know it's the time of year when people are preparing their interviews for surgical training positions. I would just like to wish everyone good luck and offer some helpful advice. You may have already researched many different resources for interview techniques. Most of these will be focused on corporate jobs, which you might realize by now are very different to medical interviews. In medical interviews, you will encounter questions of a clinical and non-clinical nature. The best way I find to approach this is to have a structure. By applying a structure, you will be able to answer most questions. I will now describe in broad terms the approach to these questions. Clinical questions are what you train for throughout your medical school. Whilst there is no technique that will compensate for the lack of knowledge, there is a way to structure that knowledge so that you can present as much of what you know as possible. The way I approach this breakdown is, firstly, have in your mind an overall structure with big headings, then fill in those headings with subheadings in which you can demonstrate your knowledge. Allow me to explain. You are likely to be given some surgical emergency. The first heading that you need to address is the acute resuscitation. Whether you use the CRISP, ATLS, or EMST protocols, you will have to run through your ABCDs. Airway, breathing, circulation, or disability are going to feature in this emergency. Focus on the one that is relevant. The next thing you need to do is describe your history and examination. By now, you should be proficient at this. Again, in an emergency, your history and examination will need to be focused to the point in order to reach your diagnosis. Your diagnosis is then supported by further investigations. This can be broken down into subheadings of bedside, blood tests, radiology, and other specialty-specific tests, such as endoscopy. Once you have made your clinical assessment, you can evaluate the severity of the pathology based on clinical, biochemical, radiological findings. This allows you to determine your next course of action. The management options are then going to be medical, radiological, endoscopic, or operative. The specific best management option will also depend on a number of factors. Patient factors, such as age and comorbidities, disease factors, such as urgency and resectability of the pathology, and operative factors, such as the requirement for subspecialists or subspecialty equipment. As you can see, if you can fill in all these headings and subheadings, you will have a very detailed answer to any clinical question. Now, the non-clinical questions are almost guaranteed to involve dealing with staff and patients, college core competencies, or healthcare policies. In terms of any dealings with staff and patients, it is important to always focus on safety. Safety of the patient, staff, and yourself, in both the immediate situation as well as in the long term. There are also a number of core competencies identified by FRACS that you need to know and come up with examples to support. Likewise, it is good to know your latest healthcare policies so that you can agree with them and show support for those policies in your interview answers. Thank you for watching, and if you find this video useful, give us a like and subscribe, and I'll come up with some more videos to help with the interview process.